Well, we talked about it at the top of the show. Sharp Urgent Care in La Mesa is shut down because of a measles scare. At least 6 people reporting to have the measles. And at this point, they are trying to figure out if it comes from the Disneyland measles outbreak, which so far has sickened 22 people. Some doctors are blaming the anti-vaccine movement. Joining us to talk more about this is Dr. Richard Chaffoo from Scripps Health. Dr. Chaffoo, I want to talk about the vaccines in a moment, but first, give me your perspective on measles in general. How serious of an illness is this, and what do parents need to be concerned about?
Well, Jen, it's a very serious illness because measles is a disease that can affect the extremes of life, the very young, the very elderly, and so it's in a relatively immunocompromised state. And the problem with measles is not just the symptoms, which initially are kind of flu-like symptoms, but there are significant complications related to flu, including encephalitis, ear infections, serious pneumonia, upper airway obstruction, bronchitis, laryngospasm. So not just the virus itself, Jen, but also the secondary complications of the virus that cause hospitalizations for patients.
We were talking in the newsroom, Dr. Chaffoo, about the fact that Sharp had closed their urgent care, and some of us thought it was a bit odd, thinking if you're sick and you think your kid has measles, you would think to take them to the urgent care, and yet the hospital closed down. Is that a smart move in your decision, in your medical expertise, and why would a hospital do that? You know,
I think that probably a lot of that decision process is made because, as you know, a lot of these diseases, flu, the measles, German measles, are oftentimes spread rapidly in closely contained environments. So in a hospital setting, and also if an urgent care is adjacent to a hospital, as you know, there are a number of very ill, sick patients that are immunocompromised, that are post-surgical patients, chemotherapy patients, that if they were to get a virus like that, it could certainly be devastating.
Dr. Chaffoo, I just had a baby, so I know certainly when you take your kid to the doctor, especially in that first year, man, there are so many vaccines that pediatricians recommend. I'm not certainly judging any parents deciding on whether they want to vaccinate their kids or not, but in your field, in your expert opinion, you have 5 kids of your own. Give me your opinion on how you think more parents deciding not to vaccinate is impacting the influx in diseases that we're seeing, whooping cough and measles.
You know, you're absolutely right, Jen. We're seeing an increased incidence of diseases that actually were eradicated, and unfortunately now there are some people that are not vaccinating their children. We know that measles is not 100%, about 95 to 98% effective with the vaccine, but if you're not vaccinated at all, certainly you have the quite often chance of getting the disease. Whooping cough, very serious disease. As you said, I've got 5 children. They're all vaccinated. So certainly the complications that are thought to be related to vaccines are nowhere near the complications of having your child not immunized. So far and away, the American Academy of Pediatrics and all other organizations and medical societies strongly recommend immunizations to protect children.
Dr. Chaffoo, before I let you go, I've only got about 20 seconds. Give me your top 2 pieces of advice for parents if they are considering taking their child into the urgent care because they think they could possibly have measles. What would you tell them?
So what I would tell them first of all is put a call into if they have a primary care physician, their pediatrician, their family physician. A lot of them, they'll have a hotline or a nurse's line, describe the symptoms that the child is having, and then get some direction in timing of when to go in. It's better to go into a smaller office than to go into an urgent care clinic where there are a lot of people near a hospital. But the symptoms of a measles outbreak are very similar to flu-like symptoms early on in the disease, where you've got fever, dry, runny cough, a sore throat, inflamed nose. But then after about 4 to 5 days, you'll start to see red spots occurring on the face, the head and neck, then extending down to the trunk and the extremities. And at that point, of course, your big concern is, are you going to get other complications related to the disease?
Yeah, all right, Dr. Chaffoo, always good advice. I know Sharp does have a triage nurse on standby just for that reason. I think a lot of other hospital systems do as well. Thanks so much for your insight.
Thank you, Jen.
Well, access to the internet here in San Diego.